Welcome back to The Blend, a podcast brought to you by the editors of Journal of the Dermatology Nurse Practitioners and Physician Assistants and the Dermatology Digest. In this episode, host Dr. Sonal Choudhary, director of the Integrative Dermatology and Skincare Clinic at the University of Pittsburgh Medical Center, chats with Mistica LaBrasca, a board-certified physician assistant and co-founder of Skin Lab by Dr. LaBrasca in Cranberry Township, Pennsylvania. The two explore all things aesthetics, including how to navigate conversations when a medical dermatology patient raises aesthetic concerns.
Welcome back to The Blend, where we bring together integrative dermatology, evidence-based thinking, and practical insights that we can all actually use in clinic. In today's episode, I'm joined by someone who brings a uniquely valuable perspective to the intersection of medical and aesthetic dermatology, a space that comes up in clinic all the time, but none of us were really taught how to navigate and integrate this. I would like to welcome Mistica LaBrasca, who is a highly experienced dermatology physician assistant with over 14 years of combined medical, surgical, and cosmetic dermatology experience, much of that spent at UPMC's Cosmetic Surgery and Skin Health Center, where she developed deep expertise in aesthetic medicine grounded in anatomy, safety, and evidence-based care. She trained in cosmetic dermatology under Dr. Susan Obagi and has become widely recognized for her skill as an injector, her thoughtful approach to facial assessment, and her ability to deliver natural, balanced outcomes, something that is not always very common to see. More recently, she transitioned into an entrepreneurial role and as a co-founder and lead aesthetic provider for Skin Lab in Cranberry Township, where she's built a thriving practice focused on high-quality, patient-centered aesthetic care. I should also add that her aesthetic sense and attention to detail is reflected in the design and decor of her clinic space that I have visited multiple times, and something that she has developed herself. Also, her presence as an Instagram influencer, where you can follow her at Skin Lab PGH. Welcome, Mistica, to our podcast.
Thank you so much for having me, and thank you for that wonderful introduction. I'm so excited to be here.
I'm glad I did justice to that because you deserve it.
Oh, thank you so much.
Before we dive in today, I want to mention something that we have all experienced in clinic. When you're seeing a patient for acne, rosacea, maybe even doing one of those skin cancer screenings, and you're wrapping up and they ask you, do you think I should get Botox? What about fillers? Will laser help my skin? And, we all do our best to answer those questions, but I want to ask you some questions today that can help us learn to bridge that exact gap. So to begin the conversation, let me just give you an opening, very important question. When a patient in a medical dermatology setting asks about Botox, fillers, or lasers, what are the most important 2 to 3 things a provider should confidently be able to say to them?
I think this is a great question. And I think a lot of providers are not confident in their ability to answer these things because, like you said, they're not exposed to these things very readily. There's not a lot of training available. So I think in general, it's important that every medical derm provider should be able to confidently say 3 things. First, I think they should be able to explain that neuromodulators like Botox relax dynamic lines. Filler restores volume and structure, and energy-based devices address skin quality like pigment, redness, texture, collagen. Mm-hmm. Basic, great overview of what we can do with cosmetic dermatology. Second, I think that the best outcomes are always going to come from patient selection and matching the right treatment to that patient. For instance, not every concern is a Botox concern. Not every wrinkle needs filler. Not every laser is the right laser, depending on the patient and their concerns. So understanding what each treatment can do and who is a candidate and who isn't. And then I think third, maybe most importantly, I would say who performs the treatment matters, because many people, I think, are way too casual about who does these treatments. Both patients and providers, I think, are guilty of this. And at the end of the day, they are medical procedures. I say this all of the time. And outcomes and complications are heavily, heavily operator dependent. So having a great referral source in this industry is imperative. So that's probably say those three things are what I would really focus on.
Absolutely. And as you were saying that, Mystica, I was thinking about my training, which was at University of Miami. Botox fillers, lasers are taught probably a little more than maybe some of the other programs as well there. And even then, I never felt super confident in going ahead and like performing it at a level or even talking about it. And my entire research fellowship was in lasers. So I have that background to help me. But guiding the patient in the right direction does require so much more, honestly. And med spas are places that I recommend patients don't go to. So when they ask, where do you want me to go? My simple answer is you need to see a medical dermatologist or a, very well trained plastic surgeon who is performing some of these procedures and such. And as a person of skin of color myself, I have experienced so many major setbacks in my own experiments with skin and lasers and such. So I always try to share some of those experiences when I notice that the patient is being hesitant to spend money or wanting to go to a specific place. So that brings me to the misconceptions. Sometimes patients have these misconceptions about injectables, fillers, like you said, to know what fits who. As a medical provider, what are the things that we should try to tell them early on to help keep that corrected in the correct line? Like if a patient's saying, should I do Botox? What is the thing I should maybe ask them saying, well, what is it that you're trying to achieve? Is that a conversation for us to have, or is that something we should say, no, I think you should go see the cosmetic dermatologist, and they will consult you and guide you through what you really need? Like, how much should we talk about there?
I think it's the provider's comfort level. I think that some providers don't necessarily want to or have the time to have that conversation. And I think in that case, referring out, especially if you have someone that you trust that you can refer directly to, is important. I think one of the biggest misconceptions in this industry is that from the provider side, I think that some providers think that cosmetic patients are maybe notoriously a little bit more difficult to work with or have unrealistic expectations. And I just don't find that to be true for the majority. I think most dermatology patients, whether they're young, mature, men, women, they're all thinking about cosmetic concerns, whether they bring it up during their derm visit or not. And most of the people want to talk about prevention, skin quality, aging, just looking less tired. Everyone's kind of thinking it. So I think cosmetic concerns are often already sitting in your medical dermatology exam room. And when patients feel safe asking those questions, I think it actually strengthens trust and long-term retention. So just leaving an open door to maybe have that conversation, but also be willing to refer out if you feel like it's something you can't address directly for them or in a confident way.
I can relate to that. Yes. I agree with you that when a patient is asking that question, that means they have some degree of confidence developed in you, if not a lot, because they were not there for that. But now they feel comfortable and safe in bringing up something cosmetic. And I always tell my patients that, hey, I don't do cosmetic treatments because I see perfection in everyone, but I know we don't see ourselves that way a lot of the times. And if you want to look even better and you're finishing things, and like you said, you're wanting to not look tired, I have just the right person for you or right team for you. And that's where I would send them. So
Yes.
say I sent somebody to you, you already have them in your clinic. What goes on in this cosmetic consultation, in this high quality discussion of yours with the patient? How do you evaluate the facial structure, skin quality, and how do you assess patient goals?
Well, for me, the first part of the consult is sitting down and actually listening. Not asking a bunch of questions up front, just let them tell their story. Before I even assess the anatomy or build a treatment plan, I want to understand what brought them in, why now, what has changed, What are they seeing when they look in the mirror? For instance, is it a mom who's had 3 kids in 5 years and she just feels exhausted and wants to look less tired? Is it someone who's going through a divorce or a job change and they're just noticing aging for the first time? So that context really matters to me because it tells you what they're really asking for. And most patients, they're not asking to look different. They're just asking to look more like themselves again. And once I understand that, then I can assess clinically facial movement, facial structure, volume loss, symmetry, and then most importantly, in my opinion, is their skin quality. And then I'm trying to figure out if their concern matches the actual problem. Because a patient might say, I hate my jowls, but the bigger issue may be mid-face volume loss or skin laxity, or maybe they need chin support. So a good consult is part listening, it's part diagnosis, and definitely part education as well.
And I would imagine that you would combine things for them in order to achieve those results. Like, as you said, it is not necessarily what always they're thinking is the center of the problem, but you're like, well, you need a little volume here, but then you also need a little lift here, and you need some skin textural work here. And hey, you might want to use this topical vitamin C to improve that on an ongoing fashion. And you need to do some regular care. So it goes into this like range of a combined approach, integrative approach, as we like to call it. Do you agree with that? Or do you have anything to add to my list?
Absolutely. Absolutely. There's almost never a time where I say it's one individual treatment and it's going to address everything. It's always going to be a combined approach. And really that's how you get the most natural looking results, is when you combine modalities. We have all of these great tools now. We have energy-based devices. We have injectables that have evolved so much over the years. So combining all of these tools in our toolbox is invaluable and super effective in a lot of cases.
That's very, very helpful. How do you set expectations and for your patients and referral timing for them in terms of, if yet like what at what point I have answered enough questions and referred them to you, but they were not a good fit? Is that something we can choose to sort of, pre-work before we are referring patients? I would just think of an example. And again, remember, I trained in Miami, so I had a slightly different experience there as well, where somebody's face is already pretty filled up. You can tell they have had a lot of things done and they are still seeking a lot more fillers. They're like, well, I need more. There is that fine line where things, no pun intended, those fine lines have been filled up, but like things are going on the side where excessive work is getting done. Are those patients someone that we should still straight away refer to you, or that is something that we should sort of talk about, discuss, handle on our own end before we are referring?
In my experience, those type of patients have to be told no more than once, and probably by more than one provider, in order for them to maybe necessarily get the message. And I think that the right time to refer is just always going to be when their goals require more advanced treatment planning. And sometimes that comes from dissolving old filler, dissolving migrated filler, dissolving areas where maybe they've been way overdone. And I would imagine that type of conversation needs to be much more in depth than what anyone in a medical dermatology clinic would have time for. And I say that very empathetically because I did my fair share of medical derm as well in the past, and I know what those visits look like.
Mm-hmm. What are some of the very bad complications that you worry about and try to prevent as you are treating our patients? What you're talking about with them ahead of time, warning them, and how do patients often receive that or work with that? Does that really, cause a lot of fear to people? They don't choose to do certain procedures for that reason, or is it just kind of like rite of passage, like you explain it and most of the times, like great percentage of time, patients would be agreeable to do that?
So I think the patients are pretty educated now. Most patients come in with some degree of understanding of what can happen. They might not fully understand the why of how it happens, but for instance, most patients know that a risk of a neuromodulator injection can cause a droopy brow or a droopy lid. Most patients are pretty understanding of what a vascular occlusion is, believe it or not. I mean, when I first started doing this close to 15 years ago, nobody knew what a vascular occlusion was. Most providers didn't know what one was. But I think there's so much conversation about these things now on the internet and on social media. Patients, they kind of know. So, which is helpful in some ways because I can talk to them about these risks and talk to them about why it happens, the occurrence rates of when it happens. And I think that's very important. And giving that informed consent is very important. So we have that conversation every single time someone's getting a treatment. The other thing is pigmentation changes, risk of scarring with lasers. That's probably the number one fear that I hear is, well, is this laser going to leave a scar? And that's a real risk. And quite honestly, that the risk of something like that happening is higher than the risk of a vascular occlusion or even a droopy lid from Botox, in my opinion. And there are a lot of providers out there who just aren't aware of the risks of using lasers inappropriately. So to me, that's one of the scarier things out there. So we're having these conversations every time someone's coming in for a treatment, and of course, signing informed consent for every single treatment.
Absolutely. The reason I asked that question is because as a provider, as a dermatologist, and people who have access to journals, we can always, in fact, patients now too, especially with AI accessibility, people can look up like what is the percentage of risk with Botox to cause this or fillers to cause XYZ. And those percentages are all documented somewhere. People have done studies and surveys on it. But
Yes.
I guess from a very practical perspective, which you already answered just now, is when I'm telling a patient, when you're going to go talk to the cosmetic provider, they will walk you through these concerns and complexities. And what I tell my patients is, if you go to what I call an unreliable provider, which is like a med spa or something, and you are spending less money or you're using a Groupon, what you're risking is that they will absolutely disown you if there's a complication. Complications do happen. Does not mean they will happen. But when they do happen, you need your provider to be able to first of all, not abandon you, bring you
Yes.
in, handle it for you, walk you through every step of it. That's what you need. And therefore, I'm recommending that you go see this experienced provider with XYZ degree who is the right person for the job.
100%. And me personally, I don't do a single procedure in my office that if there was a complication, I wouldn't be able to manage myself.
Mm-hmm.
But I make sure that if it's something that can happen, it's something that I can fix. And just all of these new practices popping up, med spas and things like that. So many new providers are unaware of what these things even look like. It's the Wild West, as I always say.
It's the Wild West. Thank you so much, Mistica, for sharing these real pearls of wisdom with us.
We hope you learned a lot from this episode of The Blend. Thank you for listening. Check back soon. We're dropping a bonus episode with Dr. Choudhary and Mistica on how to become a reputable skinfluencer and grow followers.